My daughter started sucking her fingers around 2 months old, and it's been her main way of settling herself ever since, which actually led to a pretty awkward moment with another mom at the playground recently. I had all three of my kids with me. Two were on the climbing frame, my baby was in the stroller, and I was making small talk with a mom I'd just met that morning. Partway through our conversation, I noticed her eyes kept drifting down toward my daughter, then back to me, then down again, over and over. I remember thinking, something's off. Why does she keep looking at the baby like that? Eventually, there was a lull in the conversation, and she just looked down at my daughter, hesitated for a second, and said, "Doesn't that bother you?" She meant the finger sucking. I told her, "Not really, no. She does it constantly. It doesn't worry me at all." That answer clearly wasn't what she expected, because her face did this little confused twitch, like she was waiting for me to elaborate. As a pediatric occupational therapist, I already had a good idea where this conversation was headed. Sure enough, she followed up with, "But what about her teeth long term?" Right on cue. This is honestly one of the most common worries parents bring up around sucking habits, and it's a completely reasonable one. Prolonged sucking, especially if it's still happening past age 4, really can affect the shape of a child's teeth and jaw as they develop. It can lead to misalignment and sometimes orthodontic treatment down the line, which nobody wants to pay for. But personally, I wasn't worried for a couple of reasons. First, the overwhelming majority of kids drop this habit on their own, somewhere between 2 and 4, well before it does any lasting damage. Second, and more importantly, there are real developmental upsides to letting a baby suck or mouth their fingers, upsides that in most cases outweigh the risk of waiting it out. So I gave her the short version that I wasn't concerned, and that if it were still happening well past 4, that's when I'd actually start addressing it. She wasn't quite done though. Her next worry was germs. Wasn't I concerned she'd be touching everything and then putting those same fingers straight in her mouth, especially once daycare started? Also a completely fair question, because yes, that exposure is real. But it doesn't worry me either, because some germ exposure at that age is actually beneficial. There's a well-known study by Lynch, Sears, and Hancock's that found kids who sucked their thumbs or bit their nails were significantly less likely to develop allergies later on. Putting their fingers in their mouth exposes them to a wider range of bacteria early, which helps train and strengthen their immune system over time. Once again, the developmental upside comfortably outweighs the risk, at least in my professional opinion. And honestly, in most cases, kids who are wrapped in too much sanitizer end up struggling more with allergies later, not less. Since we were standing in a playground and she was basically a stranger, I didn't launch into the full explanation of every developmental benefit right there, but I'm going to walk you through all of it now, so you understand exactly why letting your baby mouth and suck their fingers is actually worth encouraging, not stopping. The first big benefit is that it makes the transition to solid food noticeably smoother down the road. Here's why. Babies are born with a gag reflex sitting right at the front of the mouth, and its whole job is protective. It stops them from swallowing something too large and keeps the airway clear. Because it's so far forward and so sensitive early on, you'll often see your baby gag on the nipple, the bottle teat, or even their own fingers the first few times something goes in. But here's the useful part. The more they practice sucking on their fingers, the less they gag, because that repeated stimulation gradually pushes the gag reflex further back in the mouth and makes it less reactive. That shift matters enormously once solid food enters the picture. If the gag reflex stayed parked at the front, your baby would gag and spit out almost everything you tried to feed them, turning mealtimes into a stressful ordeal for everyone involved. But once that reflex has moved back, they can actually chew and swallow food without constant gagging, which makes mealtimes dramatically calmer and more enjoyable for both of you. So, in a very real sense, all that finger sucking in the early months is quietly doing the groundwork for solids later, desensitizing the mouth exactly where it needs to happen, well before the first spoonful ever shows up, and setting your baby up to actually enjoy eating rather than dreading it. On top of that, letting your baby mouth their fingers helps them build real control over their tongue and jaw movements. Specifically, it teaches them how to move the tongue side to side, which turns out to be an essential skill once solid food enters the picture. The way this skill develops is genuinely fascinating. When their fingers touch the side of the tongue automatically reaches toward that touch to explore and lick it. At first, that's purely reflexive. Nothing intentional about it. But with repetition, As they keep sucking and exploring with their tongue, that reflex gradually turns into a deliberate, learned skill, giving them real control over how their tongue moves. And that control matters enormously later on, because eating solids requires shifting food from the center of the tongue out to the side to chew it properly, then back to the center again to actually swallow it. Without that side-to-side coordination already practiced and in place, chewing and swallowing solid food becomes a much clumsier, more difficult process for a baby to figure out from scratch. Beyond that, sucking on their fingers exposes your baby to all kinds of different textures, tastes, and temperatures. That early exposure helps their brain learn to recognize and process these sensations calmly, so they're far less likely to spit food out or recoil dramatically the first time something new touches their mouth. Put all of that together, and the transition to solid food becomes noticeably easier and safer for your little one. But that's just the eating side of things. Letting your baby suck their fingers can also make your entire first year noticeably easier, meaning less crying and more genuinely calm stretches of the day. That's because sucking is deeply soothing for babies on a physiological level. It's honestly kind of remarkable. When babies suck, their heart rate drops, their blood pressure drops, and their overall stress levels come down measurably. That calming effect is so reliable that medical professionals frequently recommend it during mildly or moderately painful procedures, which is exactly why a doctor or nurse might suggest letting your baby suck a clean finger, their own fingers, a pacifier, or even nurse briefly during a vaccination or blood draw. Now, you might be thinking, since a pacifier offers the same soothing benefit and doctors already recommend it, why bother with fingers at all? And it's true, a pacifier can be just as calming in the moment. But there's a catch most people don't think about. Until around 7 months old, babies simply don't have the fine motor skills to pop a fallen pacifier back into their own mouth. So every single time it drops out, they need you to physically pick it up and reinsert it. And they'll usually make that need very clear through loud, immediate crying. Fingers work differently. By around 2 months old, your baby already has the coordination to get their own fingers into their mouth and suck on them independently. That means they can self-soothe without waiting on you every time, which in practice adds up to noticeably less crying overall and a lot more peaceful stretches for both of you throughout the day. There's one more benefit worth covering: teething relief. But before I get into that, quick mention: if you want a clear picture of what to actually expect across your baby's first year in terms of developmental milestones, and when something's actually worth being concerned about, grab my free developmental milestone chart using the link in the description below. It's completely free, and it's genuinely useful for knowing what's normal versus what's worth flagging with your pediatrician. Okay, back to teething. When teeth are coming in, gums get sore, tender, and genuinely uncomfortable, which is exactly why teething babies tend to get so fussy. One of the simplest ways to relieve that discomfort is applying gentle pressure directly to the gums. And that's precisely what happens naturally when your baby sucks on their fingers. The pressure helps ease the soreness without you having to do anything at all. This turns out to be especially useful because teething usually kicks in somewhere between 4 and 7 months, an age where babies often struggle to grip a teether and get it into their mouth reliably. Fingers, on the other hand, are always right there and easy to control, so babies can comfort themselves through teething pain entirely on their own. No extra help required from you. That said, sucking alone doesn't always fully take the edge off teething pain. And that's usually when parents reach for teething gels. Worth knowing, a lot of those gels contain ingredients that aren't actually great for your baby, especially with regular use, which raises the obvious question: what else actually works? In the next video, I'll walk you through 4 teething remedies that genuinely soothe sore gums safely, without the risky ingredients and without costing you much at all. And as for that mom at the park, once I gave her the short version of all this, she just laughed and said she wished someone had told her that with her own kids. Turns out most parents just want to hear it's actually okay.